Filler materials are substances injected into living tissues to correct volume defects that are congenital, acquired, or age-related. They restore facial proportions, lift depressed areas, and enhance the aesthetic and functional harmony of the face. Currently, the most used are absorbable products like hyaluronic acid, prized for their biocompatibility, safety, and natural integration. They offer an effective, minimally invasive alternative for treating wrinkles, folds, and facial volume loss. It is crucial to distinguish between absorbable, semi-permanent, and permanent fillers, selecting the right option based on facial anatomy and the patient's profile. The face is divided into 3/3, upper, middle, and lower, each exhibiting unique aging characteristics and treatment responses. Additionally, there are high-risk vascular and nerve areas, such as the glabella, nasolabial folds, infraorbital region, and nasal tip, where incorrect technique can lead to serious complications. The use of blunt cannulas and the supraperiosteal plane is recommended to minimize risks. Tissue response to fillers follows a predictable pattern. Neutrophil infiltration at 24 hours, monocytes at 48 hours, giant cells at 7 days, and dense collagen formation by 8 weeks. Under normal conditions, this process promotes product integration. However, granulomas may develop as a chronic inflammatory reaction, an infrequent but significant complication that must be explained to patients. The most common indications include correction of mild to moderate laxity, volume restoration, and facial contour improvement. Permanent products are best avoided, and a precise anatomical evaluation must always precede treatment. With knowledge, proper technique, and correct product selection, these treatments can deliver safe, reversible, and effective results.